Hi, everyone. I hope everyone's having a good start to their week and their semester so far. My name is Celine Nguyen. My pronouns are she, her, hers, and I currently live in Irvine, California. I am a second generation Vietnamese American. I identify as bisexual and as a cisgendered woman, as well as a neurodivergent individual, having received treatment for anxiety and depression. I was raised Roman Catholic, but I no longer actively practice. I currently work professionally as an advocate for incoming Vietnamese immigrants, generally helping them obtain their student visas and connecting them to our local communities. I have previously worked as a clinical research coordinator, as a genetic counseling assistant, and I've had volunteer experience as a crisis text line coordinator and a domestic violence advocate. In terms of what I'm hoping to gain from the course, I'm looking forward to gaining more knowledge with working with children and adolescents and their family systems. While I have worked with students and children in an academic setting previously, and have had contact with adolescents and young adults through my work in crisis text line and domestic violence advocacy, I am looking forward to the distinct modalities and techniques we will be learning pertaining specifically to parent-child therapy. In terms of what the most interesting or different things about myself, I would say that I am a bit of a hobby hoarder. I'd say my most recent ones are within the aerial arts, specifically pole dancing, and I've also recently taken up wood burning, to the dismay of our central air system. I have taken courses in medical Spanish and Vietnamese, and I'm also a new dog mom to a 5-year-old Shiba Inu Corgi rescue from Korea. I think that two or three of my biggest fears concernings when I think about working with children and their parent or caregiver systems are that just understanding that working with children and adolescents can often be difficult for a number of reasons. Perhaps some of these viewpoints are biased, but I recognize that children and adolescents in therapy are oftentimes at a crossroad in life. Some may want to be there willingly, while for others, therapy may have been a condition that was set by their parental unit, a caregiver, or by law. In terms of, I believe that two or three of my personal strengths that will help me in my work with children, adolescents, and their family members are just from my personal experiences, first and foremost. I have known the frustrations and anger and despair that comes from feeling like my concerns and opinions and knowledge are being dismissed simply due to my age. I think that in my personal life, over the years, I've strived to always have a careful listening and validating ear for the children and young adults I have had the opportunity to interact with. I have also an interest in our current popular culture, and I have tried my best to keep up with the slang and vernacular that our teens and children use and are exposed through social media, school, and their peers. In terms of professional or paid or volunteer otherwise, strengths that I believe will help me in my work with the parent and child therapy systems, I have had the opportunity to navigate fostering connection and mediating parental slash caregiver expectation with their children's needs through my work as an SAT tutor and as an after school program teacher for gifted and neurodivergent children. My time as a crisis text line counselor has allowed me to guide children as young as 10 years old to adolescents and young adults in moving from a hot moment to calmer space through active listening, validation, and collaboration. I still have a lot to learn. I recognize that, but I hope to bring these foundational skills in my journey to becoming a competent marriage and family therapist that's well versed in the familial systems that shape both parents, caregivers, and children alike. I'm definitely looking forward to this semester within the parent and child therapy course, as well as the program as a whole. And I'm excited to interact more with my cohort and to meet everyone and work together in collaboration to learn more about this particular part of the field. Thank you so much for your time, and I hope you're all having a wonderful day.